Brett Bolton's natural Max Hair Vitamin is for men and women who want better overall health and vitality for their hair. Dr. Bolton is a hair restoration specialist who has been in medical practice for over 20 years and has solely focused on hair. Max Hair, his unique formulation of natural vitamins and herbs that help prevent hair loss, stabilizes and strengthens hair quality while speeding up natural hair growth cycles. Max Hair makes your hair more resilient, thicker, shiny, and beautiful in appearance, helps prevent breakage and split ends, and in many cases has helped regrow hair follicles to their original quality. Natural and safe Max Hair gives you the beautiful hair you desire. Max Hair, for everyone who seeks a more youthful and rejuvenated appearance to his or her hair. Order yours today.
Excellent. And, yep, seasoner. Excellent. And then let me, uno más, down, yes. Right now I'm taking pictures of the FUE. Good. Otro lado. Excellent. Excellent. Okay, make yourself comfortable, my friend. Whew. Okay, so here we are with our patient, Adrien. Adrien had an FUE hair transplant a couple of years ago, and he's here for a corrective surgery. Tell us how you feel about your past procedure.
Horrible.
Okay, so you had an FUE, and you were not happy with your results? Did you not get good density?
Not good density.
And were you happy?
No result.
No result at all. Okay. So would you recommend an FUE procedure to others?
Huge area, you know?
So you would not recommend the FUE?
Not recommend FUE.
Okay. And so you're here today to correct your FUE?
Yeah.
Okay. And what are your goals today with your procedure?
Whew. I'm nervous because
Relájate, relájate. Are you nervous about the procedure?
Yeah.
Because you don't want the pinches, the shots?
Maybe.
Okay. So you're scared it's going to be painful? Because of your previous surgery it was painful?
Un poquito.
Poquito. Okay. Okay.
Little pain.
Okay. So when we're done, we're going to do another video and you'll see, you're going to say, wow, I can't believe that's it. It's going to be easy.
Super easy.
Super easy. Okay. So now, in español, por favor, ask them questions. Tell us about your last procedure. Did you have pain during your last procedure? So forth.
Hola, soy Jorge, ¿cómo está? ¿Cómo te sientes hoy, Adrien?
Un poquito nervioso, pero las cosas cuando tú tienes que hacerlas. Y realmente no me gusta estar calvo. Es un procedimiento largo, pero al final del día el resultado 100%.
Cuéntame de tu procedimiento anterior, cómo fue con relación al dolor, con relación a la densidad que tuviste.
Con respecto al dolor, me imagino que será un poco igual, ¿no? Pero la densidad que tengo hoy en día es nada.
¿Qué tiempo duró el FUE pasado?
El FUE aproximadamente 10 horas.
Wow.
And so now we're going to show the FUE, what it looks like. So what they did with the FUE is they go through and they punch a little hole, a little hole, a little hole, all the way through to get the hair. They say it's scarless, but as you can see, there's more scars, and they create this polka dot appearance that looks unnatural. So what we need to do today is clean this up as much as we can and get as much donor as we possibly can and correct the previous transplants. The majority of the work that I'm doing today is corrective hair surgery on cases just like this. We correct more FUE cases than anything else. The reason being is they're getting very little results, and their donor is actually much worse off for future surgeries because there's less hair where they've taken the donor punches from. Think of it like a piece of Swiss cheese. Simplest analogy. If you eat a piece of Swiss cheese, the hole's missing, don't give you cheese. Well, the holes here don't give us hair. And that's the best way to explain it. So what we want to do is get them on the preventative treatments, Propecia or Rogaine, to stabilize this so we don't go backwards. And then we want to move as much of this donor to the areas without hair as possible. Josh, would you like to add anything?
No, other than the decision-making process that he had was, you might ask him why he chose that to start with.
Okay.
You know, and who the doctors are. Are they doctors?
Okay. So why did you choose to have an FUE?
¿Por qué tú quisiste hacerte el FUE? ¿Porque tenía miedo a la cicatriz? ¿Tenía miedo a algún doctor?
Una cicatriz.
So he was afraid about the suture
The
line.
suture. Okay. So he had the FUE because he was afraid of the linear suture line. And this is typical. They're afraid of the line, but then they get no result and they destroy the donor. And so then they end up having the line anyways.
When you switched that to Bolton, ¿por qué tú decidiste hacerlo con el Dr. Bolton?
Ok, con el tiempo uno se da cuenta que el FUE no hacen resultado, porque cuando tú buscas densidad, lo mejor es la cirugía, obviamente. Es el 100% lo mejor.
You're looking about density. Is the reason he don't want another FUE and he want a straight line.
Okay. Excellent. All right. Anything else?
The aspect of people making choices where they think they're getting a doctor and they're not. That's a significant aspect
Okay.
of what we're seeing with people
Okay.
coming through the door. That should
Okay.
be.
So many of
about.
our patients who are coming in after they've had an FUE, what we're finding is they're having the procedure done by non-doctors, whether it be a technician or maybe even not even a licensed doctor or anything, and that's pretty common. And due to the expansion of the FUE and the Artas, we're seeing it all the time, where patients are having these poor results, and their answer, what they're telling us, is that the doctor wasn't even there for the procedure. And that's what happened to you too, correct?
Correct. Yo les recomiendo a los pacientes que se documenten bien sobre la cirugía. No FUE, definitivamente. No FUE.
He said he wanna do to the patient. He always recommend review all the results. He said the FUE he don't like anymore. He recommend to the other patient do the procedure like this.
Excellent. Okay. All right. Any questions? Bring with us. Okay. All right. So we're gonna Joyce get you started here. Okay, my friend.
My implant started 10 months ago, and my life changed. My friend, my family is wow. Your faces change everything.
There's nothing more than we love than when our patients come back with their head held high and their shoulders up and excited to show us what we did for them.